Hi, I'm Dr. Larry Burchett, MD, and this is your 5-minute coronavirus weekly update. Along with Katrin Sadigh, Infectious Disease Doctor, the two of us will summarize the evidence and facts that you need to know each week with coronavirus. Let's start with the case numbers. As of today, June 4th, 2020, there have been 6.4 million confirmed cases of coronavirus worldwide with 383,000 deaths. In the United States, 1.9 million confirmed cases, a little less than a third of the confirmed cases worldwide, with 109,000 deaths in the US from COVID at this point.
My name is Katrin Sadigh, and I am an infectious disease physician. I'd like to start off by speaking with you about race and ethnic disparities. As crowded protests demand racial justice around the country, everyone's wondering what will happen to coronavirus, especially to the Black and Latinx communities. For months, scientists have been studying how COVID relates to race and ethnicity. Here's what we know so far. Some studies have found that Black patients are both hospitalized and dying at much higher rates. What we don't know and need to better understand is if it's racial, socioeconomic, or both. We'll definitely revisit as the science becomes more clear.
While it does appear that both cases and deaths in the United States are trending down, experts worry about the effect of protests, rightly so, anti-racism for George Floyd's murder, what the effect is going to be on coronavirus cases, where thousands, tens of thousands, hundreds of thousands of people across the country gathered in close contact, many without masks. When might we expect to see the spike in those numbers? Remember, the incubation period for coronavirus is thought to be 4 or 5 days. So people who potentially got exposed over the weekend, Friday, Saturday, Sunday, may not show symptoms until Wednesday, Thursday, Friday. They might not go in until the following week. So there may be a delay between when those people end up testing positive and we see a spike in coronavirus cases. As always, if you're going to protest, try to maintain a social distance and wear a mask, both to protect yourself and other people. Now, for more on racial disparities and COVID, we go to Dr. Kat.
Let's move on to the next talking point, genetics. Now, what if we could predict how well or badly a person does with COVID-19 infection based on something scripted by their genes? An Italian and Spanish research collaboration analyzed the genomes of many people, looking for genetic markers determining risk of respiratory failure. While this study is pending peer review, results show that people with blood type A have a higher risk of respiratory failure, while blood type O was somehow protective. Interestingly, a group of Chinese investigators published similar observational results back in March.
That came out this week in JAMA on June 3rd, the Journal of the American Medical Association, on convalescent plasma that I want you to know about. What is convalescent plasma? That's when we transfuse the antibodies of somebody who has gotten over coronavirus, who has survived and developed their own immunity to it, and we transfuse that into somebody who's sick. Now, they did this study in China, around 100 patients, that was promising. It showed people got better faster, but they didn't have enough patients to justify those results so that they could go worldwide. So what do we conclude with this? We say maybe there's some promise. We need to do more studies to more further investigate it. And that's how science is. It's got a very high level, a high standard of proof, so that it's not just chance or anecdote, but that it's actually proven to work. So with convalescent plasma, maybe. Now, the other thing I want you to know from this study is that it did look like once people are super sick in the ICU, intubated, that it doesn't work then. And so it really appears that there's this window for therapy where right when people start to get short of breath, not at the beginning when you just have a fever, but when you start to get short of breath and sick, but before you're in the ICU on the ventilator, that's when we need to intervene, and whatever works, whether it's remdesivir, the antiviral, or convalescent plasma, that's where we give it. If you've been sick with corona and you've gotten better, I would still give plasma to continue to study this because it may be something that can help in the future.
Let's move on to the next talking point, global trends. Currently, the United States has both the highest number of cases and the highest number of deaths related to COVID-19. Brazil has reached over 30,000 deaths, with the New York Times reporting that country's president as stating, "We are sorry for all the dead, but that's everyone's destiny." Brazil, along with India, Peru, and Iran, top the list of countries showing the greatest growth of newly reported cases. While reasons for this increase may be related to better reporting or simply represent new footholds of the virus, it is clear that this story is far from over.
We just talked about intervening in that therapeutic window where somebody's sick and you could potentially give them convalescent plasma, for example. But what about preventing it? Once someone who's been exposed to somebody who has coronavirus, is there anything you can do to prevent them from developing the disease? Remember, President Donald Trump came out and said he was taking hydroxychloroquine for that very reason. Now, in the beginning, hydroxychloroquine showed some promise. We were pairing it with azithromycin. Everybody was being treated with this. Every patient that I saw in New York and in California had gotten hydroxychloroquine and azithromycin. As we learned more and more, it appeared that hydroxychloroquine, according to studies, really wasn't as effective as we originally thought and may cause harm to many people. So it's fallen out of favor. But what about using it as a prevention like Trump was doing? What's the science behind that? Great study in the New England Journal of Medicine, the gold standard of studies, the randomized, double-blinded placebo trial, where they took a group of 800 people that had been exposed to coronavirus. Half of them got hydroxychloroquine, half of them got a placebo. And they wanted to compare and see which group ended up progressing and developing coronavirus more. And what did they find? There was no difference. Coming to the conclusion that for this study, hydroxychloroquine didn't prevent anybody from developing coronavirus once they had been exposed. I think the percentage was like 15% of people exposed went on to develop it, something like that. So that really is evidence against the use of hydroxychloroquine as prevention. I think most doctors, I wasn't doing that to begin with, and I don't think most doctors were. This just adds evidence to that practice. So if you were thinking about it, take a look at that article and make up your own mind. Thank you for watching our 5-minute weekly coronavirus update, where we bring you the facts and evidence you need to know for coronavirus. For Dr. Katrin Sadigh, I'm Dr. Larry Burchett. We hope you share this, and we'll see you next time.